Working with musicians is always difficult because they're so picky, which is a good thing. But when I was first asked to join the Musicians Clinics of Canada, when I was first starting out about 25 years ago, I said no, because you can never please a musician. With the technology we had at that time, with the assessment we had, we didn't really know what we were doing. I've been working with John Chong, who's the medical director, for 25 years. And we've changed our programs, changed how our intervention therapies, changed some of the technologies we use. And I think we're fairly able to address most, if not all, of the problems that many musicians have. I'm an audiologist, so hearing loss, of course, is my greatest interest. Typically in our society, with non-musicians, 10% of people in the society have a hearing loss. But that's including many senior citizens. So, in fact, the majority are senior citizens. The case is a little bit different with musicians. 9 out of 10 musicians that we see for not hearing-related problems, wrist problems, back problems, 9 out of 10 of them have a measurable hearing loss already. It's usually a very small hearing loss, but that's the beginning. And over time it progresses and gets worse and worse. And it might be 20 or 30 years into their career or enjoying music before they may even recognize it. Yeah, as a rule of thumb, if you look at rock and roll musicians, approximately 37% of those people have hearing loss. 52.5% of classical musicians have hearing loss. And this came from studies back in the 1990s. I worked with the Chicago Symphony is the 52.5% figure. And these are all sorts of people, the violin players, the trumpet players. Interestingly enough, classical musicians have a greater hearing loss generally than rock and rollers. And it's not just the intensity or how loud the music is, but it's the duration of how long you're exposed. A rock and roller may be on stage for maybe an hour or two during a gig on a Friday night and may or may not pick up their guitar for another week or two. Whereas a classical musician would play 6, 7 shows a week. They would practice for 3, 4 hours a day and perhaps even teach for another 3 or 4 hours a day. So the total number of hours per week of a classical musician being exposed to music is much, much greater, hence a larger dose of music exposure. And in fact, music exposure can be thought of a dose, just like a radiation technician has to have a little card, and when it turns black, the radiation technician has to take a vacation. Same with music exposure. We have dosimeters, and once you reach your daily or weekly dose of music, it's best to either wear hearing protection or just take some time off if you can. The dose is related to 2 separate things. One is the duration, how many hours you're being exposed to, and the intensity. We measure intensity in something called a decibel. In fact, there's a meter called the decibel meter or a sound level meter. And they're not very expensive. You can buy them almost anywhere for less than $100. And you can take them into various venues. Turns out that anything over 85 decibels can, in fact, over time, if you're exposed for enough hours, permanently cause a hearing loss. Now, 85 decibels is not particularly loud. A dial tone on a telephone is 85 decibels. Flushing your toilet with your head in the toilet is 85 decibels. Soft rock is 85 decibels. Rock and roll can be about 110 decibels. If you're at a hockey game or any sports stadium and there's cheering in the crowd, that can be 115 decibels. Classical music can certainly be up to 120 decibels. So there's a mismatch here between the intensity and the duration. The intensity, 85 decibels, that's a figure that we can actually measure with a meter, and the duration. Nobody is exposed, or very few people are exposed in everyday life to 85 decibels for 40 hours a week. It doesn't usually happen, but there's a relationship. Yes, 85 decibels for 40 hours a week is 100% dose. But so is 88 decibels for only 20 hours a week. 91 decibels, 3 decibels up half the time, 10 hours a week. Now we can be exposed for 5 hours a week at 94 decibels or 97 decibels for only 2.5 hours a week. That's volume 6 or 7 on your iPod or your MP3 player. So we can be exposed to intense levels for an hour or two here and there, and that's already enough to give us 100% of our weekly dose of noise or music exposure. If you listen to your MP3 player on volume 6 or 7, you've essentially, after about an hour or two, reached your maximum dose, and it's good for moderation. If your favorite song comes on, turn up the volume, enjoy it, just turn it back down to a more reasonable level after. If you've listened to your MP3 player, or if you've done something that's noisy or musically noisy throughout the week, don't mow your lawn on Saturday morning. Give your ears a bit of a rest, or get someone else to mow it for you. If you are a musician, mention it to your healthcare professional, definitely. There are certain injuries that are preventable with correct training. Hearing loss is one of them, or hearing loss prevention specifically is one of them. You'd think that sound or noise or music would have to be painful before it's damaging to your ears, but that's not the case. A dial tone, if you listen to it, can be damaging, and nobody would say that's painful. So sometimes people call hearing loss the invisible handicap. It doesn't rear its ugly head until 20 or 30 years later. Life would be easier if we damaged our hearing, blood gushed out of our ears. It would be a little bit messy, but it would be very obvious what would happen. But it doesn't work that way. So people should seek out an audiology test. And it's a pretty routine audiology test, because hearing loss shows up as a very characteristic pattern on the test. If you think of the piano keyboard, we test hearing from about the middle of the piano keyboard to the far right side of the piano keyboard. And it turns out that if you have music exposure, the last couple notes on the right-hand side, the top end of the piano keyboard, seems to have to be a little bit louder before you could hear it. That is, there's a little bit of a loss. And that tells us it's probably music or noise exposure rather than an ear infection or some other temporary problem. People speak up there. That is, when we listen to speech and we say, oh, we understand speech, we're hearing the lower frequency vowels, and that's the stuff in the middle to the left-hand side of the piano keyboard, but we're also listening to the consonant sounds, the S's, the SH's, and the TH's, and they're up there as well on the right-hand side of the piano keyboard. So in fact, in English, in most languages, not in all, most of the clarity, most of the understanding comes from those higher pitched consonants on the right-hand side. And if you don't hear them very well, you might say, oh, I hear you, but you're mumbling. And so people with a hearing loss from music exposure, noise exposure might say, oh, I hear you, but it's not clear. You're mumbling. It's not as crisp as I would like it. But that would take 20 or 30 years for that to happen. If we can prevent that from happening in the first place, especially with a 15-year-old young musician or musician wannabe who is just there for their health checkup, by doing a hearing test and making sure that there's no loss of sensitivity on the right-hand side of the piano keyboard, to give them strategies. Strategies such as wearing hearing protection. And there's hearing protection now for musicians that is what we call flat. That is, it treats the bass note, the mid-range, and the high notes all the same, and they drop it from a damaging to a non-damaging level. So you can still hear the music, you can enjoy the music, and it's safe. There are certain environmental strategies as well. For example, if you know that there's going to be a loud sound, a clash of a cymbal or something, you can hum, almost inaudibly, that nobody can hear you. It turns out that in the middle part of the ear, the outer ear is where we hang our glasses on, then the ear canal, then further in we have the middle ear. That's where children get ear infections. Connected to the little bones of the middle ear is a little muscle called the stapedius muscle, and it contracts or tightens up upon loud sounds. The reason we have it from an evolutionary perspective is that our own voice will not sound too loud to ourselves. It turns out, though, that if we hum or elicit this little muscle, the little bones of the middle ear tighten up, and these loud sounds that will be coming in are lessened in intensity before they actually get to the ear. And the damage is in the inner ear, further in. So if we can prevent the sound from even getting there at a damaging level, we've done a good day's job. We as humans are not very good at discerning intensity. A dial tone is damaging, but nobody would consider it loud. We're better at frequency differences, or if we have if we're off pitch, we know that, but not in terms of the intensity. So using a machine like a dosimeter, and there are some commercially available ones for less than $100 you can clip onto yourself, and when the light turns red, you know you should take a break. These things are available to you, and there's no reason why you can't do that. Humming, using dosimeters, don't smoke. It's recently been shown that smoking exacerbates your hearing. It has to do with the amount of oxygen that gets to your inner ear. The inner ear is the size of my small fingernail. That's, by the way, metric for this in Canada. It's a Canadian joke. But in there's 13 to 15,000 nerve endings. And when some of those nerve endings die in the inner ear, also known as the cochlea, then you have a hearing loss. Now, if there's not enough oxygen supplying the different chemicals to the hair cells of the inner ear, they die easier. They die easier. They're more susceptible to damage, I think is a better way of saying it. So if you smoke, it's not a bad thing. It exacerbates your hearing loss. Along the same vein, do your push-ups. It's not so much to build up the big muscles, but have a good cardiovascular system. We thought, for example, that just because you would be 80 years old, it was inevitable you would have an age-associated hearing loss. Well, it turns out that is true for 80-year-olds that are couch potatoes. But if you compare them with 80-year-olds that have good cardiovascular function and try to keep themselves very fit, statistically their hearing is much, much better than their couch potato friends. So just because you're a senior citizen doesn't necessarily mean you're going to have a hearing loss. That's right, lifestyle changes, being generally healthy for a number of cardiovascular reasons is also good for your hearing. The best analogy, I think, when it comes to hearing loss of the inner ear is imagine yourself on a tropical beach someplace with palm trees. A tidal wave comes in or a hurricane comes in, knocks these trees down a little bit. They would flutter in the wind a little bit. It's not bad, but as the waves continue over the years, or they're very large waves, it can actually knock over these trees. Now we have 13 to 15,000 of these trees in our ear, and we can afford to lose almost 80% of them and have no significant measurable hearing loss. But once we exceed that, we will have a measurable hearing loss. Once those trees have been knocked over by loud noise, or maybe they're not very healthy trees because they don't have the right nutrients, the oxygen and other things, then once they're knocked over, they're knocked over. That you cannot regrow these trees or these nerve endings in the inner ear. So prevention is so, so crucial. If you look at the chemistry of how the inner ear works, it's really very, very interesting. There is a substance called glutamate. We have it throughout our whole body. It's what we call a neurotransmitter substance. And what that means is that in between the nerve endings, we have this little chemistry going on there, and it allows the sound to get from one, or the impulse to get from one nerve to the other. And we have glutamate in our ear. Well, it turns out that at high levels, we have more glutamate to the point that it becomes toxic. That's another mechanism of how we lose it. But also, it turns out that if you're negatively predisposed, if you're stressed, if you're nervous, glutamate is created in even higher levels. And so it makes the ear a little bit more susceptible to hearing loss. So if you can relax, if you can listen to music that you like, that's a good thing. Not that liking makes you less susceptible to hearing loss, but it's been shown that bad music or music that you don't like is more damaging to your hearing, given the same intensity level in decibels and same duration. So do yoga perhaps to relax you. These are all good things for your mind and your body, and also prevention for any hearing loss. Well, I would never say to a musician, don't rehearse. I would never say to a musician, don't practice, or even teach. Many musicians are not the best paid, and they have to teach. And they have to sit next to somebody screeching on their clarinet. That's inevitable. And so they will be exposed to many hours of performance. But we can actually recommend the hearing protection that will take it from a damaging to a non-damaging level, even if they want to wear it only when they're teaching, or only when they're rehearsing, or only practicing, and maybe not during the live performance. Anything that would minimize the contribution towards this dose would be very useful. So you don't have to wear hearing protection all the time. You just want to get that dose lower than 100%. Many musicians wrongly feel that hearing protection or placing something in the ears would alter their music. They're wrong. That was the case prior to 1988. In 1988, a new type of an earplug became available that was flat or uniform, and it treats the bass notes, the mid-range, and the high end, all the notes of the piano identically, so that the music still sounds like the music. It doesn't alter it at all, other than to uniformly drop the intensity from a damaging to a non-damaging level. These are called the ER-15s. There's a few different companies that manufacture these. Any audiologist or any hearing healthcare professional can get these for the musician. And there's no reason why a 15-year-old musician should be 30 with a hearing loss, with the earplugs that are now available, with the counseling, with the strategies, the moderation that is now available. Beethoven's a very interesting creature. I haven't seen him recently, but the last time I saw him, there was evidence in the literature that Beethoven had not a musical related hearing loss. He had what some people think is otosclerosis, which is an awful sounding word. And all that means is that the bones of the middle ear stiffen up a little bit and fail to transduce the sound into the ear. And it's like plugging your ears like this, that if you put your tooth to your amplifier or your piano or even your fridge door, you'll hear it much louder. And there are pictures of Beethoven holding a wooden spoon in his teeth, holding it to a piano, or cutting the legs of the piano, bringing it closer to the floor so the vibration. There's also some evidence that he suffered from mercury poisoning, which can be very toxic. That time of age was not the best time for good food and good control of toxic things like zinc and mercury and other heavy metals like lead. But I think in his case there was enough poisoning of his whole body that some of these toxins got into his inner ear and created some damage to those nerve endings or these floppy trees and caused them to flop over easier. So we're not positive whether there was only one source of music exposure. There may have been some music exposure during Beethoven's time. In fact, I'm sure there was as well. So here we have the stiffening of the bones of the middle ear called otosclerosis, which today, by the way, is treatable with an operation. We have maybe some music exposure from the loud noise that he was exposed to, and maybe some poisoning from some heavy metals that was in everyone's diet back then. There are many professional musicians out there, and every type of music you can imagine. Perhaps the first one to come out of the closet, if I can use that phrase, was Pete Townsend of The Who. In Canada, we call it Whom. But Pete Townsend was on the Smothers Brothers show, performing with The Who. And as you recall, if you're old enough, The Who loved to have explosions, and they're the group that destroyed their guitars on stage. And it was commonplace for the drummer to place a discharge of an explosive source in his drum kit. And unbeknownst to the drummer, the technicians from the Smothers Brothers show also added a little bit more, and it really exploded. And it was from that one insult, Pete Townsend had a permanent hearing loss. And you can, although that's rare, you can get an insult from that. Pete Townsend has actually spoken very publicly about the ringing that's in his ears, what we call the tinnitus, and also the pitch perception problems. He plays his guitar and everything sounds a little bit flatter than it should be. So I think when you think of musicians, you think of Pete Townsend of The Who. If you look up at any MTV or any video now, you see virtually all musicians wearing what look like hearing aids in their ears. They're not hearing aids, but they have the same function. They're what we call in-ear monitors. They replace the big wedge monitors or the sidewash loudspeakers up on stage. And each one of these musicians were concerned enough about the hearing to have a custom-made mold with a cable that goes down to a wireless pack, and they get the mix of the music that they want. And when doing so, the sound level at the eardrum is much lower than it would have been had they used other monitors. So virtually every musician you see that is wearing some sort of earplug or ear monitor, and this goes to U2, it goes to the Stones, and all these people, Shania Twain, if you like country music, virtually everyone that you see on TV now has some form of ear monitor. So I would say that in 1990, 20 years ago, it was not cool to wear hearing protection. It was not cool to protect your ears. Because of efforts like Pete Townsend and other people, now today it is cool. In fact, it's stupid not to.